Hello, my name is Andrew Wiens, and I serve as Vice President of Government Relations for the Wichita Regional Chamber of Commerce. Thank you for joining us for this video today. We're going to be doing a bit of a deep dive on COVID-19 data, with a special focus on what the data shows in Sedgwick County. I'm certainly no data expert, but I'm glad to be joined by a couple of them today. We hope this information is helpful to you, whether you're a business owner, manager, employee, or just an interested spectator. Let's get right into introducing our guests on this video. So rather than performing another long introduction monologue that you're used to seeing from me on these videos, I'm going to let our guests introduce themselves for the most part. So first off, we're thrilled to be joined by Christine Steward, who works as Deputy Health Director for Sedgwick County. Christine, thanks for joining us. I want to start by saying thanks for your service to the community. I know you and your colleagues are working crazy hours while we're going through this crisis, and we appreciate all that you are doing to help fight COVID-19 and help keep us healthy and safe. So with that, I'll go ahead and turn it over to you, Christine, to greet our viewers and briefly discuss your background.
Thank you. Thank you for having me today. So I just wanted to mention that I have a background in microbiology and epidemiology. I've worked at hospital microbiology laboratories, helping healthcare providers diagnose infectious diseases, and at the CDC, working on drug-resistant bacteria. For the last 8 years, I've worked at the Sedgwick County Health Department, starting as a disease surveillance epidemiologist, so a person that tracks the spread of disease, then an epidemiology program manager, then health protection director, and now as deputy health director, I assist the health director with her duties, and I lead a diverse team of 28 staff that monitors and protects the health of Sedgwick County residents and ensures a high-performing health department. And my passion is working with data and communicating results.
Awesome. Thank you, Chris. We're also happy to be joined today by Chamber Member Joy Eakins, President of Cornerstone Data. Joy has put together some pretty interesting visualizations of COVID-19 data that I'm excited to ask about in a little bit. Joy, I'll let you say hi and talk briefly about your background, including your current work at Cornerstone Data.
Sure. Well, so I have a master's degree in applied mathematics and actually a second master's degree in theology. And I've spent my career studying data, statistics, and understanding how to help tell the story that data has to tell, recognizing patterns in data. And my kind of whole career has been stepping into different industries and helping them look at patterns and then figure out how to make sure that the people that need to read their data know what it means. So I've started Cornerstone Data 12 years ago in 2008, and just excited to still be here, part of Wichita.
Very good. Awesome. Thank you, Joy. Finally, we're joined by the Chamber's legislative consultant, Jason Watkins. Jason's no stranger to most, but Jason, why don't you say hello and tell us a little bit about you?
Well, hello, and thanks for letting me join the call. I am Jason Watkins, Chamber consultant for legislative matters. Before that, actually worked at the Chamber as Director of Government Relations before I started Watkins Public Strategies. And then prior to my government relations career, I actually served in the Kansas legislature in the House of Representatives for 3 terms. So appreciate being included today, Andrew.
Thanks, Jason. So let me start off with the first question for Christine. So there's a lot of information about COVID-19 that's seemingly floating around in the ether these days, whether it's Johns Hopkins, the CDC, KDHE, public health departments, kind of an alphabet soup. Could you tell us where to find the various COVID-19 data from our county, state, nationally, and worldwide?
There's a lot of data out there, that's for sure. And you get different numbers sometimes looking at different websites, but that's the way they collect it. So some websites are just static, once a day updating, and some are more in real time. So WHO is more of a static. They put a report out every day about what's happening worldwide. And CDC actually links to their site. So I would go with them for worldwide, and Johns Hopkins. Johns Hopkins is more real time. They get data from lots of different sources, including social media and then state health departments. And so that's good data there. It may not always be entirely 100% accurate, but it's pretty good. And then CDC, of course, has good national numbers that get fed into, they get the data from the state health departments. So that's good for national. And then they also have, CDC also has resources for business and critical infrastructure workers as well, I wanted to mention. KDHE, which is the Kansas Department of Health and Environment, they're our state health department. They have data also, and I think their website's mainly updated once a day. And because there's a lot of data, and the health departments in general are focused on our disease investigations and making sure that we're controlling the spread of disease. That's our first priority. But we're realizing that we need to, educate everybody and tell everybody what's happening and get indicators to monitor and let everybody know what's happening in the communities. And each county is different. And then Sedgwick County, we have our own website. We put up our data dashboard last week. Thanks to our county GIS department, which was awesome. So we have some data there. Not all the data that we have is listed on there, but we are working through and trying to inform the community about all the things that are happening in Sedgwick County.
Great, that's very helpful. So one of the things you touched on is kind of the sources and how these entities receive the data. Mm-hmm. So are they, obviously it depends on the entity and who's collecting it, but are some of these entities communicating directly with hospitals and testing centers, and or is there kind of a clearinghouse? Can you kind of walk through that a little bit and maybe talk about particularly, Sedgwick County?
Sure. So disease investigation is not new to us. That's a core function of public health. We do disease investigation. We investigate whooping cough cases, salmonella cases. So we have a case management system that we share with the state. So what happens is hospitals test, primary care physicians test. When a test result comes positive and it's a reportable disease, such as COVID is, then it gets electronically transmitted to the state health department, and the state health department receives that in the case management system. They look and see where the person lives. So if they're a Sedgwick County resident, then they open that up and they say, this is a Sedgwick County case, and they route it in that system to Sedgwick County. So we get it very soon after they receive the laboratory test. And so we can enter, when we make our phone calls and when we do our case investigation, we enter all that data into that system, and the state can see that in real time, and then they can enter comments in, and so we can see that it works very, very well. And we are very lucky not all states have that kind of system. And that was all set up. We've been using that for years. Kansas was one of the first to have a case management system in the whole country. So that works well. We can also get data out of that. And so that is what helps us identify what our cases are, what the exposures are, who the contacts are. We can share, we can only see Sedgwick County data. So if there's a person that is works in a facility in Sedgwick County, but they live in Butler County, that would not be our case. That would be a Butler County case. So that's confusing to some people. And they would need to, if there's a reason for us to know about it, then they would need to share that in the case management system with us. Otherwise, we wouldn't be able to know that that person was there. So that's in a nutshell what happens. And so then the state health departments collect all that data, and then they send to CDC some of the data. Not all of that they collect, but some of it goes to CDC, and that's how CDC gets their data.
So really, just to clarify here, and you talked about this, but just to make sure it's crystal, it's kind of a push from Sedgwick County and from other counties up to KDHE to the state level, and then they push it on up to CDC. Yes.
There's some health departments in Kansas you can imagine that are frontier health departments, and so they only have maybe 1 or 2 people in their whole county that are working in the county health department. They hopefully won't have as many cases as we do, but they might be stretched very thin very fast, and so KDHE might help them with disease investigations. But in Sedgwick County, we have enough capacity here to do our own and push all that back up to KDHE.
Okay, that's great. So talking about the data dissemination process from Sedgwick County, specific to Sedgwick County, can you talk about the dashboard you mentioned and sort of how that process works of you guys getting the data and then pushing it out?
Sure. So we can analyze in that case management system, we can analyze that data, and then we have worked with GIS, like I said, to put our dashboard up. And so it's still kind of a manual process. We have a spreadsheet that we put that in, and then it pops up on the dashboard. We're working on indicators now for the recovery process. You probably all are aware that it was presented, or a draft was presented yesterday to the BOCC about our recovery. So we're working on indicators so that we can make sure that we have all of those in place to monitor our recovery over the next year, year and a half, that we're going to have to do this until we have a vaccine. and even beyond that. Right now, we continue to monitor for influenza, so it would be the same kind of thing we would be monitoring for this probably long term. And so we get that data from the case management system, put it on the dashboard. We are looking to create more dashboards and more tabs, I guess, on the dashboard to put out more data as we get it. And we want to be careful to not identify people. So when we had our first cases, we couldn't put out very much information, but now we're getting, sadly, we're getting more cases, and so we can start expanding what we're reporting. When we first started reporting, we could only report greater than 60 years old, less than 60 years old, and now we're getting enough numbers to be able to spread out those age groups so people can understand what's happening better.
Gotcha. So
and also wanted to
go ahead.
Go ahead. Sorry. I was also going to say that we are also using a system that helps us with case investigations, case tracking, or contact tracing. And so it's doing the work of at least 3 people. It automatically contacts all the contacts every day via email or via text message. And if they put in that they're experiencing symptoms, then we call them, we get a message alert right away and call them. And that's been very helpful to use technology that way.
Okay, great. Sorry to interrupt you. So one of the reasons for not being able to share as much information early on was because of healthcare privacy concerns. Is that correct?
That's one of the reasons, and we were so focused. It came so fast. We just had our first case about a month ago, and so it happened so fast. We have a core group of people, epidemiologists can analyze data, they can do disease investigations, but when it hits so fast, we have to buckle down and do our disease investigations and make sure that we're controlling the spread of disease, and then figure out we're bringing more people on, we need to get data out, we need to analyze all of this data, so we're doing that now.
Gotcha. And this is a side note, but when I heard that you were going to be joining us for the webinar, I Googled your name, and first thing that came up, or one of the first things, was you on a video being interviewed, TV station in town, I think a couple years ago, maybe last year, talking about how to prevent influenza. And a lot of the prevention advice is the same for influenza as we're hearing for COVID-19. But it was kind of fun to see that. So I'm sure this isn't new in the sense that you haven't gone through trying to prevent the spread of disease before. It's just kind of a new beast as far as how it spreads, right?
And the magnitude, oh yeah, it spreads very quickly, but the magnitude and how fast everything has occurred, it is overwhelming to the public health system right now. But we in Sedgwick County have the capacity, and we've been keeping up with all of our cases and everything. I'm glad to say that. So. Yeah,
and I'm sure you didn't wake up, one day in March or February and think that this was going to be the next month and a half of your life, but here we are. So again, appreciate your service.
We are expecting to be doing these case investigations just like this for 1.5 years.
Wow. Yeah. It's more than a month and a half. So I'm going to put you on the spot here, but can you take a pause break from kind of behind the scenes look at the process and give us a quick update on today's Sedgwick County numbers that you're tracking?
Sure. I just called our epidemiology program manager, and she said that we're reporting 316 cases as of now, 6 deaths, and 144 recoveries. Does everybody know what a recovery is? Do you want me to tell you what a recovery is?
Actually, yeah, if you could explain that, that'd be awesome.
Okay. So a case is usually a person that's tested positive, and normally they've had symptoms because the PCR test that we're using has been in short supply, and so we've only been testing people with symptoms, but we're getting more supplies in, so we'll be able to test more in asymptomatic people as well. So a recovered case is a person who has had 72 hours after symptoms start, or 72 hours after symptoms stop, or 7 days after symptoms start, whichever is longer. So that's a recovery, and we like to report those. Not all counties are reporting them. Some are, because we want people to know that a lot of people are sick, but they're not dying. They're coming out of this, they're recovering, and that's the good news of this. And we have about, I'd say 10% of people who are hospitalized around there. And so there are very, very sick people, and we want to make sure that no one else gets very sick and has to go to the hospital for this disease. And that's the reason we're putting out the information and trying to get people to do their social distancing and not spread the disease around.
Great. Yeah, I think it's helpful to have that information on recovery. So thank you for sharing that for Sedgwick County. So beyond that, what are some of the inferences you're making from the data you're seeing, or kind of what are you reading between the lines in the numbers that you have?
Yeah, so we know we analyzed all the lab tests last weekend, and we know that we're not testing everybody. There's a lot of people out there that we know are probably positive, that probably have the disease, but they're not being tested, or they're not seeking treatment, or that they're asymptomatic and they don't know that they have the disease. And so the numbers that I reported, the 316 people, we know that's only a drop in the bucket of how many people are actually infected in Sedgwick County. The good news is that the hospitals are not overwhelmed, so that's great right now. But we want to make sure that we're increasing our testing capability. And so we're doing that. We're getting more swabs in. You might have heard that we've had supply chain issues for nasopharyngeal swabs. Who could have imagined a couple months ago that we couldn't get a simple swab to test people? So we're getting more in, and the community, the physicians in the community are also getting more supplies in. So what we want to do is test more people to be able to have a level of testing to where we can know that the numbers we're reporting are representative of the community. And right now it's at like the tip of the iceberg. And so we want to know, as we go into the recovery period, we want to know that we have a sustained testing to be able to say, is that a 14-day decrease in cases? Is that real, or is that just a testing artifact? Are we just testing less or testing more?
Okay, thanks. I'm going to combine my next couple questions. If there's anything else you'd like our members to know about the data, I'd love for you to share that. And then before we switch gears over to Joy, can you also kind of direct our viewers to a few websites where they can go to get updated information, including maybe the Sedgwick County data?
Sure. So the main message is we just need to test people more. So we have a drive-through testing at the health department. Some other people do, some other groups do in town as well. Ours is no cost. So if anybody needs testing that you know of, if any of your staff need testing, please have them just dial 211, and it's no cost, and they can drive up and be tested and get the results back. And so that's the main thing. There's no longer an age requirement or an underlying health condition criteria, so just anybody can call and get an appointment and have that testing done. So you wanted me to share some websites? So how do I do that? You just give me the sharing part?
Well, you could either do that, or if you just want to give us the Sedgwick County URL, you can just say that if you want.
Sure, I have that here. It is, I have the one where the data is, and it's longer. Just a second here. It is www.sedgwickcounty.org/COVID-19/. And then you'll see the dashboard first thing when you go there, and you can click on that and see the data dashboard.
Perfect. Thank you, Christine. So let me move over to Joy now. Joy, you have a little side project going on with creating visualizations, which is a hard word to say. I'm going to try to stop saying it. But you've been creating these graphs and charts on various COVID-19 metrics and data. So can you tell us about this project a little bit and why you decided to create it?
So really, it was a lot of curiosity on my part. Obviously, I live in the world of data and thinking about data and how it's used. And lots of things I was seeing on social media were showing curves, but the curves in the process of talking about flattening the curve, people were showing cumulative total cases, which they never resolve and go down. They always keep going up. And so I thought, well, that's interesting, but it's not really helpful to know if we're flattening a curve or not, because it'll never go down. And so really what we do here is we step into different industries and different areas, and we look for patterns in the data, and we use our statistical analysis to see what story the data is wanting to tell us. And so I thought, well, I'm always looking for unique ways to think about data in different projects. So I thought, well, here's one, that's sitting right there. And there's a ton of data out there. So maybe I'll just start with my own community. And so I just started with Sedgwick County, where we live, trying to pull that data together. And as I posted and asked people for questions, they asked a lot of great questions that led to adding additional things. And, you know, I mean, Chris Steward is obviously well qualified and knows all these things about disease that I don't know. I'll say that right up front. I don't know. But I do know data and how to look at it and think about it. And so that was kind of what led through all of this.
Cool. So maybe instead of discussing at length, why don't we just have you show us what you've created? I think you can share your screen to just show off some of these charts and some of the numbers. So why don't you walk us through the highlights, Joy?
Sure. Can you, let's see. Can you see that?
Yep.
Great. We started with Sedgwick County data, and like Chris said, one of the really amazing things about Sedgwick County is they tell us about recoveries. A lot of counties don't share that information, but it really helps you know how many active cases you have. So I defined active cases in this graph just as the number of cases reported minus the total recovered and deaths. So that gives us a picture of where we are. And so you kind of look at this data, and because I always care about all the numbers, I've also added new cases per day. And obviously you can see this spike earlier in this week. And this data is current as of Wednesday, the 22nd. That's the last time I've pulled data. But obviously we had a spike this week because of a little cluster, or kind of a large cluster we had in Clearwater. And so that's showing in the data and is concerning. But overall, Sedgwick County's had, it kind of looks like maybe they have a curve here, but it's hard to tell. So one of the things that we do in data analysis is when you have a lot of volatility, there's a time delay between taking the test and getting it back. There's weekends, sometimes things take longer over a weekend to get seen. So what you do in statistical analysis is you start looking at moving averages to see if you can pull out some of that volatility and see what those trends look like. So that was kind of the next thing we did here. And so you can so here's just the raw data of new cases. And then we said, well, over 14 days, what does it look like over 5 days and over 3 days? And so as we kind of looked at this data in Sedgwick County, as it's being reported, we see in all of them that about April 10th, we had sort of our average new cases per day sort of peaked and then started to fall off. But obviously, as we pick up this new data in Clearwater, it starts to show up through that moving average. So that was kind of an interesting, interesting number and interesting graph to look at. Then I put this all up on some social media just to say, hey, here's some things we're seeing. Wichita, Sedgwick County doing a great job. Let's keep flattening the curve. Let's keep doing, you know, the things we're doing to try and drive these numbers down. And then I started getting questions from people about, well, what if Sedgwick County, or what if Johnson and Wyandotte counties aren't in the data? What does the data look like then? And so kind of the premise behind that idea is that we have big numbers. So if we pull our big numbers out, what happens in the rest of the county? So when you do that, you have to start looking at data per capita because every county has a different population, or in this case of COVID, we're talking about rates per 100,000 people. So what was interesting to me was I started pulling out Sedgwick, Johnson, and Wyandotte counties, and the numbers didn't look better. In fact, some of the numbers started to look worse. And so that's when I started just kind of throwing some maps together to say, what is going on in my data? And so you'll see this map a lot on the news. They'll show the numbers, the counts by county, and it looks, you know, there's a good concentration in these areas. That's true if you just look at numbers. But when you start looking at the rate per person and you start pulling those maps together, you get an entirely different picture. In fact, Wichita and Johnson County almost disappear in the data. And you start to see that you've got some bigger issues happening out here in the West. So that's in Ford, Kansas, 618 cases per 100,000. And then in Steward, you have 392 per 100,000. In Sedgwick County, we have 51 per 100,000 that are reported right now. So on a per capita basis map, we kind of barely register. And so then I started just kind of pulling more data to look at that in ranking counties. So it turns out Johnson County is 19th right now, and Sedgwick is 25th in a per capita case rate. And even this week, we've seen these spikes show up. This this has changed quite a bit in the last week with some of the spikes we've seen in Ford and Steward and Finney County. So so just to put that into perspective, if you start looking at some of these other counties, I'm not sure if you can really see this little orange line down here, but this orange line at the bottom is Sedgwick County's number compared to other counties in the state. So when when some of my rural friends are saying, well, we don't really have it here. Well, actually there are areas that do have some good spikes going on. And that's important for us to know as a state so we can deliver the supplies that they need and get them what they need. So while we have 35 counties that don't have a case and 93 with fewer than 30, the hotspots in our data are not our largest population centers right now. And if you really want to put this in perspective, one thing that helps me is to look across the country and see what those rates are. So in New York, which has been sort of an epicenter, the numbers are 1,295 per 100,000. Colorado, high cases as a state was 175 per 100,000, and Louisiana, where my folks live, is 535 per 100,000. So when you look at some of these numbers, like Fort County, that's 618, that county is larger than the state of Louisiana in their counts per 100,000. So a small population center with a lot of cases can very quickly begin to need help. So that's kind of where we started with the data and what we've been looking at and thinking about as we look for the patterns.
Awesome. Thank you, Joy. I'm going to go ahead and turn it over to Jason and ask him to ask you a few questions about this stuff. So go ahead, Jason.
Yeah, well, thank you, Andrew, and Joy, great job putting this together. So first off, can you direct the folks watching today how to find the webpage with the data visualizations that you've shared?
Yeah, I'm going to put a link on our homepage, which is cornerstonedata.com, and I should have that up there by Friday.
Okay, terrific. There's lots of talk and fairly broad agreement from policymakers that we need more testing. Can you talk a little bit about how some of the research you've done on increased testing and whether that translates or correlates with higher rates of infection?
Sure. So it is important that we have testing, and Chris gave some great information about why and how. And part of the reason is so we know how to deploy the sources, right? I mean, especially when they're in low supply, we need to know where we get those to. But one of the underlying questions that I was hearing from people was, if we haven't tested a lot of people, can we trust that we kind of know our rate, our positivity rate? So one of the things I wanted to look at was studying the correlation between your test rate as a state and the percent positives that you're getting. And one of the things I wanted to know is if we're testing at a certain rate, will we, by definition, is there a high correlation that we're then missing cases? And so the first thing I did was from a site that I think the Eagle used, the COVID test project. I just pulled their data this week for the entire US and every state, what their test rates per 100,000 are and what their percent positives are. And one of the things that Chris alluded to, and we've talked about a little bit at the chamber, is that your positive rate is really important, what that positive rate is, because you will, if you do more testing, you will have more positives, but is your rate going up by a lot or slightly? So in Sedgwick County, when we first started with the data, we had a rate of about 7.5% to 8% positive, and now our rate is at 10%. So my question was, if I have a higher test rate, will that necessarily directly impact my positive rate? Is it a linear correlation? And can I trust that the test rate I have will give me accurate ideas about the spread of virus in my community? So I pulled this data for the entire US and I ran a linear relationship between the percent positives and the rate per 100,000. And the correlation coefficient turned out to be 0.31. Now what you really want it to be is the closer to 1 it is, the more reliable that one impacts the other directly. And so when you plot on a line, if they were directly correlated, then as I increased my test rate, my percent positive rate would come up and they would all follow along a line. But you can see the data is pretty disparate and it's not really lining up very well. So I thought, well, And what's interesting about that is if I look at Kansas, Kansas is down here. We're the lowest rate as a state. And our percent positive is about 10.6%. And but New Mexico is rating, and I'm gonna not be able to find them right now, but New Mexico is close to us. Or I'm sorry, they're testing at a rate about 3 times the Kansas rate, but their positive rate is only 5%. It's half of ours. And others are testing at a lower rate, more similar to ours, like Colorado. Colorado is only testing at a rate 1.25 times our rate, and their positive rate is much higher at 21%. So what that tells us is if we are doing testing, we will pick up what's happening in the community, which is what we would expect to see, and it's good to see. And if a number starts to take off in a county, then we know that we've had some kind of intense spread, and we would want to make sure we could deploy supplies or make different choices as business leaders about that. Well, that's all great, but what we know is that different states have different rules for testing. And so what I started thinking about is what happens in Kansas, where states' rules are county rules are a little more aligned because the state has been sort of defining what some of those reasons are. So I pulled the Kansas data for the same thing, and I ran the same test, and our correlation coefficient is still 0.42. So higher test rate is still low. This correlation is still low, and we really want to see that above 0.5 to say there's a correlation, and we want to see it above 0.75 to show a strong correlation. So what I am seeing that as, or meaning, is that more testing isn't going to necessarily mean a higher percentage of positives. It will tell us how many people, but it won't give us a higher percentage of positives unless the virus is taking off in that community. But less testing doesn't mean a lower percentage of positives either. So for example, Jewell County here, if I can find Sedgwick on here, Jewell County is testing here at almost the same rate as Sedgwick, but their percent positive is a lot higher. So even if you're at a low rate, if you start to see the virus in your community, it will show up in your test rates. And Finney County is kind of having the same thing. So while we work to get the supplies we need to really make sure we address the issues that we're having, and as I've talked to some of the people who run hospitals and other health facilities, making sure that they know how to deploy their PPE appropriately by who's coming in and who has it, all of those things are important. But as citizens, we can feel good to know that while there are probably some uncaptured cases here, just because we would test more wouldn't mean that we would see a higher percentage positive rate in our community. And so if our community was about to sort of take off with cases, we would have seen that, we would see something like what happened in Ford County earlier this year. So again, I'm not a medical expert, so there might be some other things I'm not taking into account. All I'm really looking at is, are those two things correlated? Because that's a question that we get a lot, and the evidence doesn't seem to suggest statistically that it's a direct correlation, although it could be nonlinear.
Oh, great, thank you for that. Can you remind us where you get your data? And then I'm also curious, what additional data would be helpful to you?
Yeah, so the first place I started grabbing data from was the Sedgwick County Facebook daily reports, and all the data in the Sedgwick County graphs is from those reports. And sometimes they don't tie out to the KDHE reports because of different times that they're taken and all of that. But I just decided for Sedgwick County, I started with that. I didn't want to redo all that data. I was going to stick with it. And I love that they have recoveries and other data that they provide. I also pull data from the KDHE website and the Coronavirus Project. I'm not going to lie, we've gathered data from other states. Gathering data from Kansas is really difficult and it's time intensive. It's PDF files or videos on a Facebook page, or in some counties, there's even less. One of the things that I've noticed, so I had a client ask me if I could pull data on Texas and help them look at what was going on in Texas after they saw this. And for Texas, I can go to their website and I can download a single spreadsheet that shows me every day by county, or every day since it started by county, what their active case count was or death count was in one click. And so I can upload that data and update it every day in about 5 minutes. Whereas in Kansas, I have to sit down and manually enter all the data and then check it because you don't want to have it wrong. So that is, it's more difficult here to get that data. I think some interesting data to have that we don't have now. I really think it would be interesting to look at data by zip code. One of the concerns about the data this week is that we've had this peak in Clearwater, and we can't separate that from other areas of Wichita to understand what's going on. But I think if you were a business owner who had people in different areas of the metropolitan area, you would want to be able to know if you had a spike somewhere. And also I think it would be really helpful as our policymakers are thinking through their designs, and they may have that data, it's just not publicly available. And the last piece of data I think would be super helpful and important is around Kansas hospitalizations. So one of the reasons we started this whole, kind of shelter process was to be able to make sure that our medical people could take care of, and our facilities could take care of people as they get sick. And that's still a really high, important priority for all of us. Like many of you, I have parents at home that are older and have risk factors. And my father is probably in the highest risk factor in the country with his history. And so it matters to me very much what happens in making sure that the medical community can take care of him if he needs to show up at the hospital. So in Kansas, they provide the health data for us, but we don't know what the capacity is as a state or as a county. And so I can look at this data and see peaks and valleys, that's great. But if my capacity line is down here, I'm in trouble. And there's no way for the average citizen to sort of know where are we at with capacity, how are we going, and then, or be able to see if things don't change. As we move through phases, one of the things as a business owner I'll want to do is watch the data so I can kind of say, oh, maybe something's going to happen to go backwards. What are those things going to be? And how will I know, how will I prepare for that so I don't get blindsided by it? And there's not a real good way for me to see that right now because I can't see capacities growing inside of our hospital or what we can handle. So, and this is statewide, so maybe all of that's happening in one or two counties. So that would be really helpful to be able to understand the capacity versus what we have. There are a couple of counties, Johnson County shares that, the number of surge beds, ICU beds, and regular beds versus what's occupied. And it would be really nice to see that over time. Most of the time we get point in time data, but being able to look at trends requires you to be able to look at data over time.
Yeah, I think the ability to see the hospitalization data would be helpful. You brought something else up though that I think is also critical. We need to be able to distinguish between just kind of common community spread of the virus and then a particular hotspot where you see a spike in numbers, but it's related to say a single nursing home in one part of the county. I think that's important for business owners so that they can make decisions. I think it's also important for the average citizen so they can make decisions about what they're going to do and what they're not going to do. And so along those lines, Joy, there's a lot of talk about COVID-19 metrics and what the experts need to see in order to reopen, or as Andrew and I like to say, reignite the South Central Kansas economy. How do you think this data impacts those policy decisions?
Well, I think a couple of things I was thinking about. First of all, we have to remember the virus is here. This is a long-term process. We're going to need to continue to take wise precautions. And we need to continue listening to our health professionals and hearing what they're telling us we need to do. Our personal hygiene, social distancing, all of those things are really important. I think we also need to be able to understand that there are hotspots emerging in our state, and some of our population is very vulnerable. So what and how do we react in order to make sure we take care of them? But weighing that against, if we remain shut down and our economy remains shut, then we won't have funds to continue to support people who maybe have issues in their family or in their life that they need help with. And so how do we balance that well, I think is difficult, and having more data and discussing it together, I think is really important, because there's probably things I've said that Chris is sitting there going, that's completely wrong. And that would be fine. I'm happy to have those conversations. but to have the conversation, to be talking about our data and talking about it in the right way is what's highly important. And then I think another broad takeaway I kind of have is I think we can have confidence that if we are doing testing, when the virus shows up in a big way in a community, the tests that they have and what they are doing is capturing that. And I think that's good to know because, there's just so much uncertainty right now. And so I think to be able to know, okay, but we are capturing, 10% of our cases are positive. So there's something else out there that people are getting 90% of the time, whatever it is, it's not hurting anybody that much, but 10% of the time we're catching it and we're seeing it. And if it grows like it did in Ford County, we see that as well. And we're able to react to it. And I think I've heard stories that they've taken federal dollars and things deployed into that area to make sure that people get what they need.
Awesome. Thanks, Joy. If you want to go ahead and unshare your screen, because I know people are real excited about seeing my face again.
Yeah.
Thank you. So appreciate you sharing all that information. Really good stuff and good conversation. I'm going to flip it back to Jason just for a quick closing comment before we wrap up, and then I'll go ahead and ask Christine, and then back to you, Joy, for some closing thoughts. So Jason, go ahead and take it away.
Thanks, Andrew. And I just would quickly thank both of our guests today. I think this is a great conversation. Certainly educates and enlightens our members and other folks that are viewing this. Decisions have to be based on the most current information possible. And it really, really helps when that information is factual. So Joy, you've done great work. I've known you a long time, not surprised by the great work that you've done here, but I think it will help not just inform our chamber members, but also our folks in government that have some very serious and hard decisions to make. And I also thank the County Health Department for joining us today. I know you're on the front lines of a very serious and difficult situation. So just can't thank you enough for everything that you do and the time that you took to join us today.
Thanks, Jason. Yeah, appreciate that. And yeah, I want to echo those comments. Christine, thank you again so much for your service, and please pass that along to your colleagues as well. And I just want to give you the floor, let you kind of provide our members with some closing remarks about COVID-19 data and how they can interpret and use what's out there. So go ahead, Chris.
Okay, thank you. I appreciate you having me on. It's been very helpful. And Joy, I did like your data. I think that looks good. The hospitalizations, that's up to the hospitals. We do not have access to that data, but I appreciate what you said, and I agree. Monitoring over time is very important. Also, about the testing, I feel like that if we get our tests up more, that the spikes that we see won't be as dramatic, and we would still be able to communicate that there is a spike in the county. But if we get our testing up to levels where it should be, then we won't be as it won't be as responsive in the data. We'll be able to track actual trends over time. So I appreciate all this conversation. Thank you.
Perfect. Thank you, Christine. Thank you for those closing comments. So Joy, thanks again for putting these charts together. I know you also have a day job, so we appreciate the great information that you've shared and the time that you took to put this together. So how about some final words of wisdom from you, Joy?
I think going forward as business owners, we need to really, and government officials making decisions, we really need to plan to be flexible and look at local solutions. And obviously, I think local politics are really, and local government is very important, and kind of done that with my whole life, but really no more than, right now is such a great example of why it's important that in Clearwater, we need to do something really specific. That's local. In Ford County, in Sedgwick, we have different issues that we need to resolve, and they're across counties. So how do we work together to do that? So that, just my takeaway from that as local business owners is how can we be flexible and local, and how can we help our government leaders do the same thing so that we can keep our economy going, or get it going and keep it going, and also take care of the vulnerable in our population and make sure that they have the health care they need.
Great. Well, thank you, Joy. I just also like to take a quick moment to remind our viewers of the page on the Wichita Chamber's website where you can go for more info on COVID-19 resources. And that is wichitachamber.org/COVID-19. And that's the Wichita Resource Center. Many of you have perused that website already. It includes information for both employers and employees, so please check it out if you haven't. And then in closing, just a special thanks to Christine and Joy for their expertise, and thanks to Jason for the help with the questions. Stay healthy, everyone, and thanks for watching.